we're here today for the Imagine Impact campaign, our relaunch of the campaign, and we are doing an interview today with Grace Wakulchik, who is the CEO of Akron Children's Hospital and a part of our capital campaign. So Grace, thank you so much for joining us today. We appreciate your time.
It's my honor to be here. Thank you for inviting me.
Sure. So we're just going to go through some questions and just have a chat and a conversation about home and kind of what it means to you and why you feel compelled to be involved in this and to bring children's involved as a company here in town. So with that, Grace, what does home mean to you?
It's funny. I haven't had time to think about that so decidedly and deliberately until you asked the question. So it was a great thought. So to me, when I thought about this, my home is a little bit different now than it was when I had 4 children at home. But to me, it's a home when I was a child in my parents' home. But I thought about home and what it's meant consistently through all those different periods of time. And really, it is a safe space where you can be yourself. And most importantly, it is a space where you can share your love with friends and families. And to me, my home is always, even though my children are gone now, is always a place that I think of as their home as well. So to me, it's an important place to be, to nurture your family. And really, I'm passionate about my home. And it's not a house, it's a home.
Exactly. And home holidays will look a lot different, certainly during this pandemic for families this year. And, they may not be able to gather, which is certainly concerning for all of us.
You're absolutely right. And that's one of the things that we're concerned about as healthcare providers is that, this is 8-9 months almost into this pandemic, and people are depressed. They're down. They enjoy meeting with their friends and families. They love that close contact with friends and families. And now the most dangerous place they can be oftentimes is with a small group of family members who are not in their pandemic bubble, if you will. So we're very concerned about Thanksgiving because we know so many people are looking forward to it as a time that they can get together with their family, with their friends in their home, which they consider to be a safe space. But at this time of the year with the pandemic going, there still may be risks to particularly elderly folks to catch the virus in these kind of settings. So it's going to be a difficult holiday season for all of us.
Yeah, for sure. So Grace, why did you choose to be involved in our Imagine Impact campaign when we came to you about kind of joining this effort with the other community leaders? What drew you to be involved?
As my passion is with children here, being a CEO of Akron Children's, one of the things that we know is that 18% of children, nearly 13 million, live in poverty. And poverty can last a lifetime. The effects of poverty don't go away when that economic, when their conditions change. So what I wanted to do was have our hospital help participate in reversing this cycle of poverty by providing and supporting the Habitat for Humanity's campaign to help provide a safe home for kids.
Well, thank you so much. So you talked a little bit about research. So, research shows that a person's access to opportunity is directly linked to the community where they live. And through our campaign, we are aiming to build up our community by building and rehabbing 75 homes. So how do you think this growth, or how do you see this growth affecting the children of our community?
Yes, that is a great goal. As you know, neighborhoods matter in how kids develop. Neighborhoods provide access to good jobs. They provide access to daycare. They provide access to healthcare. They provide access to grocery stores, and they provide safe playgrounds for kids. So by providing those supporting communities, we can help mitigate the harmful effects of the economic disadvantages that may exist in some communities or neighborhoods. So really excited about your campaign to improve our neighborhoods.
Thank you. And currently where we're building right now, I certainly want to highlight that effort. We kicked off a partnership with the hospital when Mr. Considine was retiring, and you were stepping into those shoes on a piece of property that was donated to us by the hospital.
Yes.
And that is 8 single-family homes, 4 of which were completed. As the pandemic was starting, we completed those first 4 during May, and then we have the second 4 under construction right now. So, without children's, and that partnership for the land, we would not have been able to do a project like that, where 8 families will exist together on that piece of property, and be able to support each other and share, and their children will be able to learn to be great friends, and right across from the school. That's the other positive, and something we had talked with Dr. James about in his interview a couple weeks ago. Right across from the school, right there at Friendship Park, there's an Acme grocery store, there's a bank inside the store, there's some restaurants and access to the highway. So that was, amenities wise, a perfect place to build 8 single-family homes. So thank you from the bottom of my heart for making that significant contribution to Habitat.
You're very welcome. It did seem to be the perfect place to locate housing for kids, didn't it?
It did.
We had that property there. I think it was an old bowling alley, and we used it for storage. And we said, really, what is the right thing to do? And the right thing in that neighborhood would be to provide great housing for kids and families, because you're absolutely right. It is across the street from the school, the playground, the grocery store. And not only that, we had a great opportunity to get our team in there to do some team building and helping us build one of the houses. So I just never imagined you'd get 8 houses on that property. That is amazing. Kudos to you. Thanks for doing that. I know that you all have the genuine opportunity to know that you are making a difference for so many families. And thank you for doing that.
Thank you. So let's talk a little bit about at-home learning that's going on right now. So it's certainly at an all-time high. Akron Public Schools made the announcement earlier this week that they will be continuing online learning, offering some, I believe, face-to-face tutoring during the COVID pandemic. So what role does a healthy and safe and stable home environment, you believe, play in a child's education and their long-term success?
So, as you know, COVID has had a significant impact on our kids and families, and really with their ability to access school and learning. It's been especially difficult for low-income families who lack adequate resources like computers, desks, space, and a stable home, and internet access. So that has been particularly difficult. Their parents may not be able to work from home, or they may have lost jobs or income, so that contributes. Children are at risk to falling even further behind academically. So having a stable stable housing where families can create a safe space for kids to learn is really important. So thank you for doing that, and thank you for providing that basic step so kids will have a place to sit down and actually learn.
Sure. Yeah, it's so difficult for kids right now. They're missing their friends, they're missing their social interaction. You mentioned earlier on, not only are adults, facing mental health and, crisis, but so are our kids.
Absolutely, absolutely. It's really, really an important time for us to make sure that those kids get access to behavioral health services, because it is significant, their loss. They're all about being social beings, right? And we've kind of taken that away from them somewhat in terms of the fact that we've limited their face-to-face interactions. I know that they're much better on social media than you or I are, but they still miss that one-on-one or group contact.
Sure. So let's talk a little bit about your childhood home. So
Sure.
you mentioned in the very beginning, not only your home with your children growing up, but then the home that you grew up in. So tell me a little bit about maybe recalling a childhood memory growing up and in your home, and maybe how you think that affected your health and education over time.
Sure. You may not know this, but I'm an Army brat. My father served in the United States Army as a career Army. He worked in the Army Security Agency. And so we moved around a lot. I mean, the longest place we were ever in one place was 3 years, and that was when we lived in Japan. So we moved every 1 to 2 years. And I remember most people won't have this kind of experience. We lived in off-base housing in very poor Japanese town. We lived in a Quonset hut that was built by the military. And so many of you will know Quonset hut because of the records, the record store in Akron, that we actually lived in one. And so and then we often lived in base housing. and we moved frequently. So, although we had an intact family and everything was great and we were economically stable, still having to move from place to place. What happened was you moved from one school system to another school system. You had to make new friends every year to every 2 years. And so different school systems have the ability, have different, are at different levels in terms of the quality of education that they provide. So you might find yourself further or ahead or further behind as you move from one school system to another. So I can really identify with those kids who have difficulties moving from one house to another, even if it's only within the city or the county, because it does make a difference in terms of the friends that you have and the kind of education that you can receive. We also, since my father was in the Army Security Agency, he often had to be assigned overseas in areas that were too dangerous for us to go. So we actually had to live with relatives for periods of time while he was on those assignments. And so that's a challenge too. But, so we may live with my great aunt or uncle or my grandparents, or my mother might have to have rented a house. So that's all continual disruption in your friends and also in your schooling. So, but luckily those were all with very loving, intact families, so that even as I would consider it to be stable housing, supportive housing, but it was different every year or so. So that would be a challenge, I think, for children who weren't as focused academically maybe as I might have been. So, for them to learn and to keep up and make a difference.
Sure. And you've been in Akron how long, Grace?
Well, I've been here for almost 30 years, but I went to Cuyahoga Falls High School. When my father got out of the service, I actually we moved to Cuyahoga Falls, and I went to Roberts Junior High School and Cuyahoga Falls High School, and then Case. So, yeah, I've been here a long time.
Oh, wonderful. Well, we're blessed to have you in this community. Thank you
Oh,
for being here.
thank you. It's my pleasure. It's a great place to live and raise your children.
Exact, for sure. It sure is.
Mhm.
So, how do you believe housing stability directly affects a child's self-esteem and their self-worth?
Oftentimes we see that substandard housing creates some psychological distress or shame for children that can cause depression or hopelessness. And so that is something that is important to us, because it's important to have a home that you can be proud of. It doesn't have to be a big home or a fancy home, but it has to be one that you know is yours, and you know that when you go there, you're safe and happy and someone's going to be caring for you. So the studies have really shown that poor housing contributes directly to self-esteem. So the more that you can do to help make that kind of a stable housing environment for our families, that would be wonderful. I think we'll put the family unit there, and you can provide the house, and then I think we'll be good to go.
Yeah. What about early childhood development? So there have been a lot of initiatives here in Akron around early childhood development. The pre-K, the birth to kindergarten initiatives, and like the Head Start programming and so forth. So
Mhm.
how is early childhood development affected by the stability of home?
Right. The research shows that the groundwork for the child's future is really developed during their first couple of years of life, as you mentioned. So when a home is unsafe or unstable or overcrowded, that stress can affect critical brain development that occurs in children up to age 3. So it really does have a significant lifelong impact.
And as you know, because I know you've been to a build site, I've watched you wield a hammer and a drill, and with your work boots on, and
Mhm.
helping us build homes. So as you know, our families have to do sweat equity as a part of building their home. So, and not only does that involve the adults or the parents building the
Mhm.
home,
Mhm.
but we also have ways where the kids can engage in that sweat equity.
Mhm.
Now, they
Mhm.
can't necessarily be at the job site holding a hammer or wielding a drill, but they can participate by getting good grades on their grade card report every 9 weeks.
Mhm.
They can participate by coming in and building a picnic table as a family, or doing different activities. So, how do you think a child being involved in that physical aspect, the emotional aspect of building their home, how do you think that affects their motivation, and maybe even pride? How do you think that impacts them?
So I think one of the things it does is help build resiliency. One of the best ways that you can help build resiliency in children is to help identify those setbacks and then help them make a difference in changing that environment. So when they go to the job site, if they're allowed in and see their parents building, or actually I think that they probably would do a better job than some of us did in terms of the building, but when they see that role model of, yes, there is adversity to overcome, but we can make a difference ourselves. And those parents are role modeling that positive attitude and how to take a situation where they may need housing and show their children that you can make a difference in changing the world. So they are really great role models, and that helps the children understand that they helped with that house too, even though they may not have been able to get the drill, which most of the guys on our site seem to want the drill. Did you notice that, Rochelle?
Yes, yes, I do.
But the power tools, I think it is. But even though the children may not have been allowed to use the power tools, that they really were contributing to changing the family's circumstance and changing their environment and creating a nice, safe home for themselves. So great role modeling opportunity, and really help those folks build resiliency,
Yeah.
and learning that there is hope.
There is hope, and especially right now, there is hope. I think we're just all so absorbed in all that's going on around us, and you know, drawn to be responsible. And we have taken volunteers back out on the job sites. We've been mostly outdoor work, where we've limited it to much smaller groups, with face coverings, with doing as much social distance as we can. When you're raising walls, you need a handful of people in order to be able to lift and set them in place, as you know from being on the site. So it just has been very difficult. We are, again, allowing volunteers to come back in smaller groups. We'll be moving inside, doing insulation drywall here very soon as the winter months, as we, come out of late fall. And again, decreasing the volunteer group size to just 4 people at a time. But, our goal is to get the houses built so that the families can, change their circumstances from, maybe where they're living in overcrowded conditions or substandard conditions, or the rent is just so high that they're spending more than 50% of their income on their housing expense. That for us is huge when we can change a financial picture for a family as well. Give them a little more money in their pockets to invest in their family's future, or even in their future. Recent survey we did of our 147 homes that we still have mortgages for, that we've built. Many of them said they were finally able to finish a college degree of some kind, or a certified training program, and increase their job opportunities because they weren't spending $800, $900, $1,000 a month on rent. Paying their mortgage at $400 to $500 a month gave them the extra money to be able to build a better future for themselves. So,
and their families.
And we welcome some children's volunteers. If you guys like to get back out, we'll be as safe as we possibly can with you all, and give you a chance to do some inside work at some of these houses.
Good.
So Grace, what would you say to donors about the direct impact of their support on our mission, not just for the campaign, but just in general, directly impacting, because you've seen it firsthand, you've been a part of it. We have homeowners who are employees at the hospital. So, you see firsthand. So what would you say to donors about why they should engage with us?
There is a direct link between the well-being of children and the economic vitality of the communities where they live. So the best investment that they can make is in children, and in children in our community. So by investing in Habitat for Humanity, they are investing in our own families here in this region.
Yeah, for sure. Thank you so much. So with that, how do you personally want to be continue your involvement, over the campaign in these next few years?
Well, I do have to say that we have missed being on the job site, and that it is one of the great opportunities that we have as a senior leadership team to get together and go out on the job site. It is a great team building opportunity. We are fulfilling a great mission for Habitat for Humanity, and it is a whole lot of fun. So that's how we plan to continue as well. Probably the most important way. You know, I think it's probably easier to give money, which we will continue to donate and support. But really, when people get involved in the mission is when you know you're making a major difference. And our team is committed to your program, and we will be back out there.
Oh, that is great news. I'm so glad to hear that. And I
Mhm.
wanted to thank you too for, allowing Tim Ziga to serve on our board of trustees. So I
Mhm.
value Tim's opinion and his service very much with us, especially with his construction background. And
Mhm.
he's served a very valuable role, a very sound advice giving role over his service thus far. So we're blessed to have Tim serve on our board of trustees, and I thank you for giving him that opportunity and time.
He's a great role model for the community. Not only is he passionate about the mission for Habitat for Humanity, but he's a darn good construction worker out there on your site.
He is for sure, and I know his daughter recently had an opportunity to do some service with Habitat overseas. I
Mhm.
can't remember. He
Mhm.
told me she was on a study abroad or on a mission
Mhm.
trip,
Mhm.
but
Mhm.
he had forwarded some pictures that she was on a Habitat build site overseas. I want to say in Africa.
Yes, that's where she lives.
Yes.
Mhm.
Okay. So
Mhm.
yes,
Mhm.
she lives there now.
Yes, she works and lives there.
I did
Mhm.
not know that she lived there, but
Mhm.
it was just refreshing to see, that not only is he involved, but so are his children. So it just all, is that modeled behavior from parent to child.
Absolutely, absolutely. So that's a great example of role modeling and how it carries on through the generations.
Oh, for sure. Well, Grace, I so appreciate your time this morning,
Mhm.
interviewing with us for our Imagine Impact campaign, your involvement over the years, that of your predecessor.
Mhm.
I truly value, Mr. Considine and his servant leadership. I think
Mhm.
he has just so exemplified that in the community, and the leadership of the hospital has just continued to move that culture forward and fulfill that servant leadership role. And I'm grateful for your support. I'm grateful for the hospital's support and for you taking some time this morning to interview with us. And we'll look forward to seeing you with that hammer in your hand very soon.
Okay, hopefully they'll give me the drill too.
The
Okay,
drill too. We'll pull it. We'll pry it away from them.
okay, sounds good. Thank you
Thank
so
you,
much for
Grace.
everything you do. All right,
Oh, thank
bye-bye.
you. Bye bye.
Thank you so much for listening to our discussion with Grace. Now is the time to join our movement. If you haven't already, please watch the other videos in our discussion. Dr. David James of Akron Public Schools and Nick Browning of Huntington National Bank are all available with more information on our website, hfhsummitcounty.org/Imagine Impact.